So we're here with our next patient, and he was referred to us by Dr. David Amram for Fraxel laser therapy. So Shane, what do you see in your skin that concerns you? What would you like us to address with this laser?
Probably texture. The texture of my skin has gotten, I don't know what the word is, it's just rougher.
Changed with time.
Yeah, a little bit of like spots maybe.
Okay.
But definitely the texture has changed, over time.
Do you notice that your pores maybe got a little bit larger as well over time?
Yeah.
Okay. Do you mind if I give you a little quick assessment of your skin?
Sure. Yeah.
Okay. So I do think that you have a little bit of rosacea. Rosacea is when the blood vessels come very close to the top layer of the skin, and they can be a little bit spastic. So with heat, if you have a drink, they can suddenly, or with spicy food, they can suddenly kind of fill with blood and you'll get blushed. Have you ever experienced that happen? Okay. I've also found that patients who have rosacea, they tend to have larger pores, and that's usually in the middle of the face and the nose and on the forehead. So you've probably noticed that as well. So there is one laser that's really made for the redness. That's the V-beam laser, or we also have the yellow laser for that indication, and that can improve the background redness. What I'd like to do today, with your permission, is to focus more, like you said, on the texture in terms of the pores and the evenness. I think what you're referring to is more the evenness. You want your skin to kind of be all the same color throughout. Is that kind of what you're describing? So I do think you're a good candidate for the Fraxel. So Fraxel, what it does is it creates little columns of injury in the skin, but leaving neighboring skin completely intact. So the skin that's left can help to make new collagen to fill those columns. Okay? I think that'll also help with your pores to kind of fill them in. So when you see a dilated pore, the collagen around it has become saggy over time. So we want it to lift up and fill in to make the pore look smaller. I understand that you were also interested in treating your neck. Is that correct?
Yeah.
So you've had quite a bit of sun exposure on the neck. So I wanted to point something out. This is called a little bit of poikiloderma of Sabat. So you see a little bit of a plucked chicken sort of appearance, excuse me for saying, to the neck with these little kind of like dots, okay, and there's a little bit of background redness. So this laser will also help to create some collagen that will help with that. It will also help with some of the fine lines in the area.
Great.
Okay?
Yeah.
You're already numbed, so we can get started. Does that sound good?
Sure.
Okay, great. We're ready to begin. Our patient has eye protection, and so do I. And we're going to start here on the forehead, okay? You're going to feel some cold air here, okay? So we just finished Shane's treatment, and we did the face and the neck. And you can see these little tiny dots when you look very closely, but from your angle it might not be very perceptible. At this point, he probably feels a little bit warm. Is that right? Is there any areas that are painful in particular right now?
Probably like right here.
Around the neck. Feels a little bit. We finished up with the neck, so that's part of it. So we put on a few potions right after Fraxel to help with healing and also to cool down the skin. So we have a special mask, a biocellulose mask, which is nice and cool, and it absorbs a lot of the heat from the skin, which is very nice. So we'll do that for him, and he can expect in the next few days to have a little bit of redness and swelling. We look forward to seeing him for his next treatment and ultimately for his final results.